Crohn's disease is something that was always uncommon, and I was startled by is that when I left India, I had barely seen any Indian patients with Crohn's disease or ulcerative colitis. But when I came back, I hear and see so many patients with this problem, which was once very foreign to our lands. It's a type of inflammatory bowel disease that typically tends to affect the young in the second, third, and the fourth decade, and we do not know why it is caused. I think for a large part, majority of these were considered to be tuberculosis and were treated in the past. Crohn's disease is today primarily treated medically and mostly by a medical gastroenterologist. Patients have a very good response with good medications that are available in the market. Unfortunately, what happens is because there is a lack of an IBD service where a patient gets the best of both worlds, where he has the benefit to be treated both by an IBD medical doctor and an IBD surgeon, patients end up getting what that specialist thinks is good for them. And that might in fact be detrimental, because I've seen patients who've been on medications for much longer than they should have been, and they would have definitely benefited from an earlier surgical intervention. Crohn's disease started off as a surgical disease and it has ended up becoming a medical problem. But I think where we should be heading and where we should be going is that we should again make it a patient problem, so that a patient gets what is right for them rather than which doctor he sees. If you've got Crohn's disease or ulcerative colitis or think you do, please do see an IBD specialist, an IBD surgeon, and try and get a multidisciplinary approach and get a multidisciplinary answer to your problem, rather than just seeing one specific person who may offer you one set of medications. IBD surgeon is able to offer you either an open approach or a laparoscopic approach or a robotic approach to the treatment of Crohn's disease, and can significantly improve quality of life when the patient is correctly chosen and treated.